Today, we're diving into something truly revolutionary. We're going to explore how artificial intelligence is completely changing the game in healthcare, giving us this incredible power to fight diseases before they can even get a foothold.
You know, when it comes to our health, early detection isn't just a nice to have. It's literally everything. It is a desperate race against the clock where every single moment matters. But what if we could actually get a head start? Just think about that for a second. What if there was a tool that could spot the very first microscopic signs of an illness, way before you even started to feel sick? Well, this isn't science fiction anymore. It's the reality of a technology that is transforming medicine as we speak.
So to really get why this is such a massive deal, look at this number. Inspired by data from the World Health Organization, for many major cancers, a staggering 70% of deaths are linked back to one simple tragic fact. The disease was found too late. It's like we've been fighting this battle with one hand tied behind our backs.
But this is where the story starts to change. We're shifting from the problem to a really powerful solution. It's time to meet the new partner that's joining doctors on the front lines, diagnostic AI.
Okay, so what is this stuff exactly? Well, put simply, diagnostic AI is like a super specialist. It's trained to look at millions of medical images, X-rays, MRIs, retinal scans, and find these tiny, almost invisible clues that signal a disease is starting. It really is like a medical detective that works 24/7, finding evidence a human eye might just glance over.
And how it works is actually pretty straightforward. First, you get a medical scan done. Then, in seconds, the AI analyzes millions of different data points within that image. After that, it flags anything that looks even a little bit suspicious for a human doctor to review. And the result? A diagnosis that's faster, earlier, and, very often, even more accurate.
Now, this isn't just happening in a couple of fancy labs somewhere. This revolution is happening all over the world. So let's take a quick global tour and see how this tech is being put to work, saving lives on every single continent.
Our first stop is Europe. You've got these incredible, high-quality healthcare systems, but they're feeling the pressure from complex diseases and an aging population. So they're using AI not to start over, but to supercharge the amazing systems they already have in place.
And this data from the OECD really paints a clear picture of the challenge. You can see the significant burden from cancers like lung, breast, and prostate cancer in these developed nations. This is exactly where AI is being deployed to make a difference.
And here's how they're doing it. AI is speeding up national cancer screening programs like you wouldn't believe, letting more people get checked faster. It's also taking on some of the heavy lifting, easing the huge workload on radiologists. And it's spotting the early signs of eye disease in diabetic patients with just incredible precision.
All right, let's hop over to the Americas. Here, the focus is a little different. It's all about boosting precision and making the entire healthcare system more efficient and cost-effective for millions and millions of people.
Check this out. This is a direct comparison with data inspired by findings from organizations like the CDC. You can see it clear as day. The AI-assisted column consistently shows a higher accuracy rate and a huge drop in the time it takes to get an analysis done. This isn't about replacing doctors, it's about making them even better.
Now for our next stop, Asia, a continent that faces a totally unique challenge. With billions of people in huge rural areas, the big question is, how on earth do you deliver top-notch care at that kind of unprecedented scale?
Well, the answer really comes down to access. Before AI, if you were in a rural clinic, you might have to wait for weeks, maybe longer, for a specialist in a big city to look at your scan. But with AI, that same clinic can get an instant preliminary screening, flagging the most urgent cases right away. It is a complete and total game changer.
Our final stop takes us to Africa, where AI is playing what might be its most critical role yet, bridging a massive gap in healthcare infrastructure and helping to overcome a severe shortage of medical specialists.
Just look at this ratio. It's unbelievable. In some parts of sub-Saharan Africa, based on data from groups like the Africa CDC, there can be just one single doctor for every 50,000 people. That's an impossible task. So in a place like this, technology isn't just a nice-to-have, it's an absolute lifeline. So here, AI is what you'd call a force multiplier. A simple chest X-ray analyzed by AI on a laptop can screen for deadly diseases like tuberculosis. Community health workers can use AI-powered apps right on their smartphones to do remote diagnostics, bringing specialist-level knowledge to the most remote villages on Earth.
So, we've seen the present, and it's already mind-blowing. But what's coming next?
what does the future hold? Let's take a peek down the road, all the way to 2040.
Okay, by 2026, which is right around the corner, we can pretty much expect AI to be a standard tool in most major hospitals. Then, fast forward to 2035, your own smartwatch might be giving you predictive health alerts based on your personal data. And by 2040, we could be living in an age of hyper-personalized medicine, where prevention is tailored specifically to you based on a whole lifetime of health info.
So, as we bring this incredible journey into focus, what's the big takeaway? What does all of this really mean for the future of our health? Ultimately, it comes down to this. This is not a story about machines replacing humans. Far from it. This is a story about collaboration. It's about empowering our amazing doctors and nurses with tools that let them see more, know more, and act faster than ever before in human history. And that leaves us with one final, pretty deep thought. As this technology gives us this unprecedented window into our own future health, it also brings up some new and really important questions. What are our responsibilities with this kind of knowledge? That's the question we're all going to have to answer as we step into this brave new world of medicine.